Hello viewer, welcome to this presentation. In this presentation, I will introduce you to a product called lycopene. Lycopene is known with this other names: all-trans lycopene, cis-lycopene, lycopeno, lycopene, lycopenes, cyclocarotene, cyclocarotene. Lycopene overview information. Lycopene is a naturally occurring chemical that gives fruits and vegetables a red color. It is one of a number of pigments called carotenoids. Lycopene is found in watermelons, pink grapefruits, apricots, and pink guavas. It is found in particularly high amounts in tomatoes and tomato products. In North America, 85% of dietary lycopene comes from tomato products such as tomato juice or paste. 1 cup 240 milliliters of tomato juice provides about 23 milligrams of lycopene. Processing raw tomatoes using heat in the making of tomato juice, tomato paste or ketchup, for example, actually changes the lycopene in the raw product into a form that is easier for the body to use. The lycopene in supplements is about as easy for the body to use as lycopene found in food. People take lycopene for preventing heart disease, hardening of the arteries, atherosclerosis, and cancer of the prostate, breast, lung, bladder, ovaries, colon, and pancreas. Lycopene is also used for treating human papillomavirus HPV infection, which is a major cause of uterine cancer. Some people also use lycopene for cataracts and asthma. How does it work? Lycopene is a powerful antioxidant that may help protect cells from damage. This is why there is a lot of research interest in lycopene's role, if any, in preventing cancer. Lycopene uses and effectiveness. Bladder cancer. Research suggests that there is no link between lycopene consumption in the diet, or lycopene blood levels and the risk for bladder cancer. Diabetes. Research suggests that increased lycopene consumption in the diet does not decrease the risk of developing diabetes. Age-related eye disease, age-related maculopathy. Research on the effect of lycopene in age-related eye disease is inconsistent. Some evidence suggests that people with low lycopene levels are almost twice as likely to develop age-related eye disease compared to people with high levels. However, other research suggests that there is no link between lycopene levels or lycopene intake and the risk of age-related eye disease. Asthma. Research on the effects of lycopene in people with asthma is inconsistent. Taking lycopene does not seem to reduce asthma symptoms in adults with stable asthma. However, in people with a history of exercise-induced asthma, taking a specific lycopene product seems to improve lung function after exercise. Hardening of the arteries, atherosclerosis. There is some evidence showing that higher lycopene blood levels is associated with a reduced risk of hardening of the arteries. There is also early evidence that higher lycopene blood levels can reduce the risk of heart disease associated with hardening of the arteries. However, there does not appear to be a link between lycopene levels and stroke risk. Enlarged prostate, benign prostatic hypertrophy. Early research shows that taking lycopene can slow the progression of prostate enlargement and can improve symptoms in people with this condition. However, other research found no link between lycopene intake in the diet and the development of an enlarged prostate. Breast cancer. Research about how lycopene affects breast cancer risk is inconsistent. Some evidence suggests that having higher lycopene blood levels is associated with a lower risk of breast cancer. However, other research shows that neither lycopene intake nor lycopene blood levels are linked to breast cancer risk. Heart disease. Some research shows that women with higher levels of lycopene in their blood have a lower risk of developing heart disease. However, other research shows no link between lycopene intake and the risk of heart attack or stroke in women. Also, increasing dietary lycopene does not seem to prevent heart attacks in men at low risk for heart disease. Cataracts. One study suggests that higher lycopene blood levels are associated with a lower risk of developing cataracts. However, other studies have found no link between lycopene intake or lycopene blood levels and the risk of developing cataracts. Cervical cancer. Research about how lycopene affects the risk of cervical cancer is inconsistent. Some evidence suggests that higher lycopene blood levels or higher lycopene intake in the diet is linked to a lower risk of cervical cancer. Other studies have not found this link. Colorectal cancer. Research about how lycopene affects the risk of colorectal cancer is inconsistent. Some research suggests that people with high lycopene intake in the diet are less likely to develop colorectal cancer than those with low intake. However, other research shows no link between lycopene intake and the risk of colorectal cancer. Gingivitis. Early research shows that taking a specific lycopene supplement by mouth Lycored, Jagsonpal Pharmaceuticals for 2 weeks or receiving a single injection of lycopene gel into the gums reduces gingivitis. Brain tumor glioma. Early research shows that taking lycopene by mouth for 3 months does not improve the response to radiotherapy and chemotherapy in people with brain tumors. Ulcers caused by H. pylori infection. Early research shows that taking lycopene by along with antibiotics does not help treat H. pylori infection compared to taking antibiotics alone. Human papillomavirus HPV infection. Women with higher levels of lycopene in their blood seem to recover from cancer-associated HPV infection faster than women with lower lycopene blood levels. High cholesterol. Early research shows that taking a specific lycopene supplement Lycored, Jagsonpal Pharmaceuticals by mouth daily for 6 months lowers total cholesterol and low-density lipoprotein LDL or bad cholesterol, and increases high-density lipoprotein HDL or good cholesterol. However, other evidence suggests that lycopene does not affect cholesterol levels in healthy adults. High blood pressure. Early research shows that taking a specific lycopene product like Omoto, Lycored Corporation, or Gange, NJ daily for 8 weeks lowers blood pressure in people with high blood pressure. However, other research suggests that there is no link between lycopene blood levels and the risk of developing high blood pressure. Lung cancer. Research about how lycopene affects the risk of lung cancer is inconsistent. Some research shows that lower lycopene intake in the diet is linked to an increased risk of lung cancer. However, other research suggests that there is no link between lycopene consumption in the diet or lycopene blood levels and lung cancer risk. Male fertility problems. Early research shows that taking lycopene by mouth daily for 3 months improves sperm quality in some men with fertility problems due to unknown causes. Menopausal symptoms. Early research shows that taking a specific product containing lycopene, calcium, vitamin D3, astaxanthin, and citrus bioflavonoids core. Con. International, Parma, Italy daily for 8 weeks reduces menopausal symptoms including hot flashes, joint pain, anxiety, and depression. White precancerous patches in the mouth oral leukoplakia. Early research shows that taking a specific lycopene supplement Lycored, Jagsonpal Pharmaceutical by mouth twice daily improves white precancerous patches in the mouth. Ulcers and swelling in the mouth oral mucositis. Early research shows that taking lycopene by mouth daily for 2 months improves ulcerations in the mouth in people with oral mucositis. Ovarian cancer. There is inconsistent evidence about the effect of lycopene on ovarian cancer risk. Some research shows that a diet rich in carotenoids, including lycopene, seems to help prevent ovarian cancer in young women. However, other research shows that the risk of developing ovarian cancer is not linked to lycopene blood levels. Pancreatic cancer. Some early research shows that a diet high in lycopene, primarily from tomatoes, seems to lower the risk of developing pancreatic cancer. Lycopene dosing. The appropriate dose of lycopene depends on several factors such as the user's age, health, and several other conditions. At this time there is not enough scientific information to determine an appropriate range of doses for lycopene. Keep in mind that natural products are not always necessarily safe and dosages can be important. Be sure to follow relevant directions on product labels and consult your pharmacist or physician or other healthcare professional before using. To buy lycopene, contact us at Providence Specialty Center, 43, Idi-ape, Iowa Road, Ibadan, Oyo State, Nigeria, or call any of these numbers. 08035688971 or 08055947565. You can also visit our websites www.wealthandtourism.com and www.providencesecret.com. Thank you.